Greetings and welcome to our second PAA CAP Town Hall. We're glad to welcome you to our live broadcast today, where we wish to speak to you about a number of key issues facing psychologists in the province. I have with me today Dr. Judy Malone from the PAA, and I also have Dr. Richard Spelliscy from the college as a registrar. And we're going to begin first with just an acknowledgement, and I'll ask Dr. Spelliscy to make that acknowledgement at this time.
Good afternoon and welcome, everyone. I'd like to begin today by acknowledging that as a province-wide town hall meeting, we are touching upon the traditional lands of Alberta's many diverse Indigenous populations, as well as that of the Métis. We do not take this fact for granted, and as we continue to move forward in the spirit of reconciliation, we want to ensure that, that we recognize these obligations. This is especially true during times of crises, which highlight the need to work together for the well-being of all. Thank you.
Thank you for those words, Richard. And I'd like to now turn it over to Dr. Malone, who has some introductory remarks on behalf of PAA.
Well, again, we are absolutely delighted for all of you who tune in live, might have some questions in the chat for us, those who sent your questions and comments to the college in advance, and certainly those of you who will be watching this recording afterwards. We work quite a bit in the background, as this is an ever-changing, really quickly evolving landscape. And so we know our partners here at the College of Alberta Psychologists and those of us at the Psychologists Association of Alberta every day and every week brings new challenges and consideration. But we're psychologists. We are leaders. We're leaders in health. And so we need to be able to pivot and change. We just need to stay on top of that. And so we are profoundly proud and honored to be working for and with our profession, with all of you here in the province. You are all leaders, and this is how we're putting some of those pieces of the puzzle together, and some of that sharing as we move forward. New territory for all of us as organizations and as individuals. I just wanted to give a little bit of an update from PAA's side. Although public education and member support and benefits is always paramount for us, this has been a really big time for advocacy. And although that advocacy, which is always ongoing, really started to peak a few months following the election in this province, it's really become profoundly more important as we work through the pandemic and this time of crisis or change, of course, in the province. So we've mentioned before, but it really bears repeating that sometimes advocacy issues are not so much in PAA's purview, because we work for the profession and for the psychological health and wellness of all Albertans. Sometimes this is also about public safety. And when those are the case, the college and PAA really do work quite closely together in presentations, letters to ministers, recommendations on policy, etc. Sometimes we do that collaboratively, and sometimes we just keep really open communication to say, if you're advocating on this from a public protection standpoint and we're advocating on this from a professional standpoint, how can we sort of maximize how the science of psychology is really here for mutual benefit for all Albertans, for our members, and really to advance society and psychologically healthy workplaces. That key sort of point about access and the need to good psychological health and wellness for all is just going to peak. Some people call it the psychological tsunami that's being predicted. Some people are calling it a psychological pandemic. Personally, I prefer for us to just acknowledge that this pandemic is a psychological event. This is not just physical, and this is an excellent time both for us to showcase our leadership in health, but also to be at the forefront of doing advocacy. I sent out a summary of some of our advocacy not that long ago, but I do just want to hit a couple of the high points. There's change and evolution all the time. Again, access to psychologists psychological assessment and treatment remains at the absolute forefront of everything that we do. We have really essentially a two-tiered healthcare system in our province where there's easy access to Medicare, but not healthcare. And psychology really is fundamental to care. So that theme or that message runs across everything we do and becomes its own advocacy initiative as well. One of the many areas where we've targeted that is in response to the school psychology layoffs. So we've done a number of very targeted campaigns and efforts specific to that, because youth are our future. And removing those core supports in school systems in a time of cutbacks, in what is also a time of some of the greatest need for parents and children and teachers, we as psychologists know the long-term effects on that. It's not just a black and white line on the bottom of a budget ledger. And so the most recent of those many, many initiatives was a joint letter to Minister Registrar from Dr. Karen Cohen of the Canadian Psychological Association and myself, just capping off a number of other very specific initiatives on that. There's an excellent infographic. We've been using social media, press releases. All of our advocacy initiatives have pretty robust advocacy and communication plans to ensure we get the message out. The jobs and the careers of our members are important. Realistically, this is about the children of the schools and the tremendous benefit. People who are laid off, we absolutely care about what happens to you and we want to help you and protect your career, but you're even more important than that. You affect entire systems and processes and families. And so that needs to be a really clear message. Another one where we did a lot of work and have had more success just in the last little while is specific to the provincial auto insurance reform committee. So there's a provincial committee looking at making changes to legislation around auto insurance that will have some pretty profound impacts for people who have either more complex or psychological injuries. We have some great volunteers. We have an excellent policy brief on that one as well, but we had some really recent success with the Trial Lawyers Association, who's opened a few doors for us. And then we actually had the government committee saying, wait a minute, can you share some of the psychological science with us? They've mostly been receiving information from the auto insurance industry itself. And so we prepared our brief, submitted it. The committee was thrilled and have taken that so that we can be in an advocacy role. Overall, this is what we do with all advocacy. We want to consult and share psychological science to help them, whoever that is, organizations or governments, to tweak their policies, processes, and procedures to be best for all Albertans. Psychological science has a lot to offer, and that's what we rely on you as members to help us to really research and prepare. One of the latest ones has been those referrals to psychiatrists. This is a situation where changes in billing codes have impacted psychologists referring directly to psychiatrists. So many of you as psychologists have practice IDs. You can apply online for your practice ID. That will facilitate some referrals. At this point, only to psychiatrists, although we're always advocating for more direct referrals. To really summarize the situation, that allows the psychiatrist to be able to bill for accepting the referral and really facilitates the process. When they change those billing codes, we have many psychiatrists in the province who have been requiring a second referral from a family physician or another physician first. This is obviously a waste of Alberta healthcare resources, physician time, and of course the psychologists who really are experts at making those referrals directly to psychiatrists. So we've now consulted with the Alberta Medical Association, AMHAC, which is a group of the psychiatrists in the province, and prepared and submitted an official policy brief to Treasury, Finance, Health, Associate Minister of Addiction and Mental Health, and there's one more and I'll think of it, but really sort of a robust campaign tied to the provincial platform. It's very easy to say, if you want to look at ways to cut red tape, fixing this small oversight really will promote better interdisciplinary care and collaboration and directly impacts not just us as psychiatrists, but those who we are serving in our collaborations with psychiatrists. I don't want to go through all of them, of course, but I guess one other highlight, if I have to pick Okay, two really quick ones. A very formal campaign where we collaborated with every province and Federal Psychology Association in Canada, coast to coast to coast, putting our names and letters on that. This was championed by the Canadian Psychological Association, and we collectively worked on it. Letters to all the major healthcare providers, insurance groups, Sun Life, Green Shield, you name them, Aviva, et cetera, clarifying the value of better coverage for psychology in their healthcare plans, their access plans for people who have extended healthcare benefits, outlining the cost savings, and really also about streamlining or making that access to psychologists easier, realistic caps on services, et cetera, et cetera. That was quite a big campaign. And the last one is, of course, just ongoing work. I finally have a meeting with one of the MPs next week about the financial impact on the profession. When it comes to small businesses, there are some really seemingly clear lines. You can run your business or you can't run your business. Well, we can do telepsychology, but have been very significantly impacted if you're in private practice. So we are so thankful to the hundreds of members who have been completing our pandemic surveys once a month. We're able to really demonstrate that we've got this huge range and it's not a normal curve. It's not bimodal. We've got members who are far more busy, but the majority of members are far less busy than before, and it has a real impact on business provisions if we don't help to find ways to take good care of you and our students and our provisionals. We're not going to have that foundation to take care of the rest of Alberta with psychological health and wellness. So that's just kind of some of those tip of the iceberg points on some of the advocacy that's been ongoing in the province in the last little while. Send it back over to you, Troy. Thanks.
Great. Thanks, Judy. I just forgot to mention that I'll be serving today as moderator and be putting questions to both to Judy and Richard today. There's been a lot of questions coming from members, and we appreciate all of those who've sent questions in today or prior to our meeting. And I'm actually, if you see me looking to the side, I will be monitoring periodically any questions you wish to put in the chat. I'll try to see if we can to get those addressed as well. We may not be able to get to all the questions, but we will certainly take note of them and see if we can't give you some good information. I know that both PAA and CAP have been working hard to make sure that there's good communication happening regarding this ever-changing and ever-moving situation with COVID-19. So with that said, I'll turn it over to Richard to see if he has any introductory remarks, and then we'll dive right into questions.
Thank you very much, Troy. And thank you, Judy, for all that you do in your organization in serving the needs of our members. It's difficult to believe that as of tomorrow, it'll only be 10 weeks since the first case of COVID-19 was identified in Alberta. The most recent data indicates that there have been 6,047 cases of COVID-19 in Alberta. Of those, 5,076 have recovered and 1,211 remain active. There has also been a significant loss of life, and our thoughts are with those families who have lost a loved one because of the pandemic and those who are currently unwell. We know that these times are particularly challenging for the communities of Calgary and Brooks, who are encountering the highest number of active cases. Before we begin today, I'd like to say on behalf of College Council, including our public members and college staff, that I would like to thank all regulated members for their adherence to the Chief Medical Officer of Health, Dr. Dina Hinshaw's guidance. The overwhelming majority of members were able to successfully transition all or some of their professional services to virtual platforms. The college has not received any complaints from the public or health officials related to the public health order compliance. This is particularly rewarding given the lack of clarity surrounding the designation of psychology as an essential service initially. This bodes well for each and every member, but also for us as a profession as a whole. It is consistent with our overriding ethical principle of responsible caring and doing no harm to others. Finally, I'd like to acknowledge the kindness and positive feedback the college has received from members as we all try to navigate these unprecedented times. Thank you for listening, and we would now like to turn to your questions.
Thanks for those introductory words, Richard. Many of the questions that we received from members in our reaching out to you had to do with the recent relaunch announcement by the Alberta government. Now, as essential service providers, we are already permitted to have direct services to our clients, but many of you may be considering a more gradual or even eventual return to more face-to-face services. So most of the questions pertain to that transition. The first first area of questions pertains to physical distancing. Some have asked questions pertaining to what if I have a small space, for example, and achieving the 2-meter recommended distance, required distance, is not possible in my environment. So that's the first question I'll pose to you.
Certainly, I can address that, Troy. One of the things that I wanted to highlight in today's conversation, that the government recently amended Order 16, 2020, effective May 4th of this year, and it establishes the conditions under which community healthcare settings, which private practice agencies and those who deliver services in the community must comply. This order requires each college under the Health Professions Act to publish guidelines applicable to all members that are substantially equivalent to those developed by Alberta Health for community healthcare settings. The college's guidelines have been sent to Alberta Health for approval by the Chief Medical Officer. Alberta Health is having its first meeting today to review each college's guidelines, and we expect to hear back from them shortly. But our guidelines are largely in keeping with the college advice to date, with the exception of mandatory pre-screening and masking of patients, providers, when a distance of 2 meters cannot be maintained. These guidelines will be sent to all psychologists and posted on the college website once they have been approved. It is the professional responsibility of each college member to be aware of and follow these guidelines to the greatest degree reasonably possible. The college recognizes that there are many stressors, especially for students, provisionals, and those members who have had their practices seriously disrupted. However, these guidelines are mandated by Alberta Health and are required to address both the public and your physical well-being. The time and expense to implement these recommendations will likely be well spent, as there is no indication of COVID-19 pandemic.
You'd like to add?
Yeah, so we're really excited to see the college guidelines, and all those are being carefully produced and approved, of course, by the Chief Medical Officer of Health, which slows everything down, and people want that information. So just like using telepsychology, we needed a second consent. We needed to think about new things. Returning to practice right now means we need a separate consent about risks and to really think about some things. So one of the ways we're hoping will be most helpful to members is that PAA has created what we're calling a checklist, where we've summarized APA, national, Canadian, coast to coast kind of guidelines, ideas, suggestions, ethical considerations about that return to practice. So we've summarized it down to a 2-page checklist that'll be on our website. I send out my e-news progress notes every Friday. I'll have links to it in there as well. And it's just meant so that you don't have to read all 15 of those. We encourage you to anyway, but we've got that list of resources at the end, and if you want them sort of summarized, they're there, and they will go nicely with CAP's guidelines, which are much more regulatory about what we need to do. It's a confusing time. How do we return to practice? How do we do that? I know today in this town hall, Troy and Richard, you're going to be answering some of the specifics on that. So we just want to help people by providing that quick way to find additional information on what's happening in other jurisdictions in North America.
Thank you, Judy. That's appreciated. The next question has to do with specific situations where you're doing specific types of practice that may require much more close contact. And so we did have some questions about what if I'm doing standardized testing? What if I'm doing other activities as a psychologist that may require being more in close contact? What are we recommending? Richard, I'll ask you to address that first.
Okay, and I would just prior to that, I'd like to thank Judy and for all the great work that that PAA has done, and also APA, in terms of providing some really concrete, clear guidance, and we've been sharing those all along. The first question that was specific was I'm wondering what you can recommend for psychologists returning to a very small practice for face-to-face where counseling rooms do not allow for proper social distancing. The guidelines issued by the Chief Medical Officer of Health state that if you cannot be separated by more than 2 meters, approximately 6 feet, you will have to be masked to provide those services. So that's going to be an essential requirement for that. I know when I first thought or heard this, I thought, well, how would that work? However, I did a little experiment at home where both parties were masked and they could communicate sufficiently to hear. It is going to present some challenges and some initial new ways of doing things, but that would be the requirement. In testing situations where social distancing is also compromised, many are turning to plexiglass shields that are set up between the psychologist and the examinee. And although those are not standardized part of a testing environment, they can be recognized as a reasonable effort to not compromise the health of the public. And I believe that that is going to be almost a standard practice for people who are administering psychological instruments, is some form of plexiglass barrier between themselves and the client. Is this going to be more difficult for when working with children? Yes, it is going to be more. It is going to be something that people are going to get used to, socialize to. But just as we have now adapted to seeing many people on the streets with masks, people driving in their cars where both people are masked. If you see an AHS ambulance go by, we know that both parties are masked in there now. So it is going to become a standard situation. I know that many of you, when we put out our request about personal protective equipment, PPE needs, did put an order in, and that some have now received their order for that equipment. And we are still recommending that psychologists who need PPE use that address, email address that we have been providing until we are told that that's no longer an available product from the government. We would also encourage people to take steps to get their own supplies just in case that service or supply chain is disrupted.
Excellent. Judy, I know you mentioned that you had found some very useful resources pertaining to use of masks. Did you want to comment about that?
Yeah, so it's a great resource that was developed out of Pennsylvania, and we were just securing that consent to reproduce this. So it'll be my Friday e-news, and we'll put it on our website. This is a terrible way to demonstrate use of technology, but here I am holding up a picture to the camera. This just sort of runs through risk factors for psychologists and clients when one or both people are wearing masks. And so again, we have permission, and we certainly will share this image from the blog. It's a nice, quick and easy way, because we know what our members are doing right now, are really struggling with balancing risks, needs, those risk-benefit analysis that we do all the time with so many things has suddenly got a lot more complicated. And we want to really try and provide some resources and information to ease that decision-making process for you.
Excellent. Thank you, Judy. The next question, Richard and Judy, is that are there situations where not wearing a mask and not using physical distancing measures would be appropriate in the current client? Like, for example, if the assessment were urgent or to meet a funding deadline was one specific question.
Well, I would suggest that it should become a standard matter of practice to have these procedures implemented. So even if you are seeing a client on an urgent basis, one of the requirements in the guidelines will be is that there is pre-screening for all clients prior to coming into your office setting, and at the time they come to the visit. It is, in my mind, going to be standard practice for any health service that you receive. At the time you book your appointment, you will be pre-screened if you're doing it live, or there'll be pre-screening questions if you're doing it digitally. And then it's also a requirement when you come to the appointment physically that you go through a screening process at that time. I can tell you that I was doing some office business and I entered a building on Tuesday and was required to do a health checklist before I was allowed to enter into the building and interact with the people, even though we were maintaining social distance. These are requirements that will be outlined in the guidelines that psychologists will have to run through the questions that are determined to be the key risk factors, such as travel, such as being in close contact with someone who has been diagnosed with COVID-19, or if you are displaying some symptoms. This is going to be a standard order of practice, and in my mind is going to provide the clients some degree of certainty that your office environment is safe, and that you are taking the precautions necessary, conducting your own due diligence to ensure that you provide a safe, healthy environment for them to offer services. It is, in my mind, going to be difficult at first, a bit challenging, but it is going to become simply a way of doing work.
Thank you for that. Judy, do you have anything you wanted to add?
You know, I just was reflecting on it as a person. So most of you know I have a chronic health condition and I take immunosuppressants. So I have very little immune system. I've had 2 medical procedures in the past several weeks. I've gone in and there's very strict standards. It's very hard for me to conceptualize a situation so urgent or a test where you can't have at least some of those precautions. And even if for some reason it's felt that they're not needed, we're psychologists. We know that things we do that create a sense of structure and safety reduce anxiety in a time of great uncertainty. So psychologists are bright. We know how to balance those risks and analysis. So you're going to be in some really tricky situations sometimes, and that's going to be difficult to assess. But for the most part, you know, if nothing else, if it helps, think of someone like me. If I'm not bringing some sort of contamination to your office, I probably won't survive receiving some that was there. So putting those extra sort of precautions in there really just make us stronger as a community as a whole for those very few times when they might not be as feasible.
And if I might add to Judy's comments, Troy, is that what I foresee happening in the future is that psychologists now are going to be offering alternatives to clients. They're going to be offering, for those who feel more comfortable receiving services in a digital or virtual platform, offering that service, particularly if they are in situations where they might be, their health conditions may lead to some compromisation of their immunization system, or the immune system. I think that might be a service people will offer. Some individuals will like to come into offices and prefer that face-to-face contact. But again, then it'll be necessary to have these workplace environment precautions in place to ensure that that service is delivered safely.
Excellent. Thank you, Richard. And that actually speaks to some of the questions that sort of pertain to individual psychologists' own sense of safety or own sense of sensitivity to the consideration of increasing face-to-face contact and whether they feel it's safe for them, as much as that they need to also consider the safety of their clients that are considering that. I will turn our questions now, though, just to move things along to some of the, there's a variety of questions that have been popping up on the chat room, as well as that were pre-submitted around the use of personal protective equipment or PPE. Some of the people are asking what specific masks they can wear, what our comments are about things like face shields, There are also questions about what quality or grade of things like that. So I wonder if either of you would like to comment about that.
I can just speak to that briefly, is that Alberta Health Services has approved a number of models of masks. Not all psychologists will need to use an N95 mask. So Alberta Health has posted different types of masks that they find are acceptable and meet their safety requirements. Some psychologists have asked about using shields and having gowns in case of droplets. And that may be true for those psychologists who are working with populations where they are exposed to droplets. And that may be whether they're working in a geriatric environment with very young children, some with developmental issues where they might have close contact, might have barriers, and there might be a greater risk. So that will, the type of mask used will largely be determined by the environment that you're working in and the level of risk. So a lower risk mask may be likely chosen when you can maintain social distance of 6 feet, but you're still choosing to use a mask because you think it's good practice, and it may make your client feel at ease, or your client maybe even with that 6 feet wanting that additional protection and those kinds of things. So it will be determined by your individual work circumstances and the types of populations you're working with. Any other things you'd like to add, Judy?
No, it's just such a unique situation. I have very few clients right now, very small private practice. And so for myself, because I'm restricted to only telepsychology, I'm even thinking some of what I was preparing myself for going in is not the same as what it is now. So some people, it's not feasible for them to use telepsychology at all. It would only be feasible to see someone in person, particularly if there are lots of social determinants of health kind of considerations, very busy households, domestic violence, et cetera, et cetera. Also, surprisingly, had more success with telepsychology than online for people who don't have as much, say, technology or are dealing with very difficult, complex kind of issues. And I can't see how that won't transfer to in-person. Same thing, right? We're going to see different variations on what's required, what's needed for the client and for us. And this is going to be really a time of adaptation. What personal protective equipment do you need? Is this about you? Is this about the client? And as usual, it's ideally a combination of the two, and it will really depend on that setting. I know members who work, with homeless populations, forensic units in jails. We have a pretty wide variety in this province of psychological practice. So good luck giving a specific response, Richard, because the variation is really so large that giving people information and skills within which to slot kind of what's going to fit for you makes sense.
And I'd just like to add, I think you're quite correct, Judy, is that it is an evolving time. These directions may change rapidly depending upon the course of the pandemic. And that is why I think both your organization and the college have worked hard to provide weekly updates to members as things change rapidly. And it's really incumbent upon members to pay attention to those emails so that they're getting the most up-to-date and current information, and they can feel comfortable that they're working within the most current parameters.
I think that's well remarked, Richard. And actually that leads me to just remind our listeners that some have asked for a reminder, for example, of where they can contact, who they can contact for trying to seek out PPE. The direct link for that request has been provided in several of the CAP last communications to members that went out by email. They're also on our website. You could probably find them through the Alberta government's websites as well, but I would recommend you take a look there to find those. So if I can move us along, one more question around PPE that comes up is about the sensitivity to, say, working with children, the comfort level with any client really in terms of face masks, the ability to detect subtle facial expressions and the limitations that it may create, and what we'd say about that.
Do you have comments, Judy?
No, I'm just reflecting on our brilliant colleagues who work in oncology. And I know you and I have had several meetings with them, including child oncology, where those are children with extremely suppressed immune systems. And so this is probably typical practice conditions for those psychologists, whereas the rest of us who might work with children are saying, how on earth can we work with children under these circumstances? So some of those individuals really be our guide. I'm sharing nothing useful here. That's the narrative that popped into my head because they have done this kind of work for a really long time.
Yeah, and my thoughts take to the fact is that if we become comfortable with wearing PPE, that I think our clients will become comfortable as well. And when we explain to them that this is a requirement because our office is small, or that that person is maybe compromised physically, health-wise, or that the psychologist is compromised, saying that I'm protecting you, you're protecting me, we're working together. I do think that the majority of people will adapt fairly quickly to that use. And again, just coming into the office, I see more and more people wearing it on the streets, and I think people are going to see that as a normal course of living for the next few months.
Thank you for those comments. And I would add that we will be talking a little bit in the next little bit on the issue of informed consent and in transitioning clients. And I think that that's another important feature, is how we explain these kinds of changes or what they might see or do, and make sure that they feel that they're informed and are okay with what we're doing and understand that the reasons for that. So moving right along, the next sort of category of questions are pertain to cleaning and sanitization, use of objects in our space. So one of the questions is that I've been seeing is what are the requirements in terms of what I need in terms of available cleaning materials? How should I be cleaning and sanitizing my space, essentially, are sort of the questions that arise. So who would like to address that first? Richard?
Sure. So the AHS website has good recommendations with respect to cleaning supplies, about both makes and how to actually make your own, and what are the manufacturer recommendations. They have the guidelines to look at how you identify whether a certain product is safe for disinfecting, and that it does do what it is designed to do. So I know that one of the questions you received is they haven't been able to find proper disinfectant. Well, our recommendation would be is to visit the AHS website. They do explain how you can use common household products to make your own disinfectant material. Others have said, well, we have cloth furniture in our office. How do we make sure it's safe between clients? And they came up with their own solution. They say, well, if we use blankets and launder them, use a new blanket on our furniture between clients and those kinds of things, and then launder them safely, that is certainly a solution. But it is a requirement from Alberta Health that all high-touch services be cleaned and disinfected between clients. And so each private practice or each office setting will require to have cleaning supplies on hand and clean between clients. And I think that, and that is true for things like hand washing and disinfectant stations, appropriate signage for things such as how to minimize aerosols from coughing and from sneezing. So those will be common practice. I know for the college, we have accessed signage and resources from the internet, have them placed as people come into the office. The receptionist desk is roped off so that the person cannot come within the 6 feet to the receptionist. Other people are recommending plexiglass shields for the reception. Our chairs have been relocated so there is 6 feet between them in the waiting room, and that we do have hand washing stations at every door that have appropriate instructions on how to do that. That, I believe, is consistent with the guidelines that you will receive from the college, and it's also consistent with the most recent public health order.
I'll just add a sort of good point. You know, in our checklist too, we say, well, okay, here's kind of the most commonly listed things in a checklist, doorknobs, et cetera, et cetera. It's going to be different in every environment. That's what Richard just said. So one environment is going to have cloth chairs and we'll have to come up with a slightly different solution, or, you know, we do things in a different way. This is where your wisdom and judgment is really going to become paramount, because there's not going to be easy, clear answers. The college will give us regulatory guidelines that will give us those great parameters, checklists like ours and that everybody else has been producing, give you some more tips or just some structure and sense of, okay, I've addressed what I need to address. There's probably going to be modifications. Fortunately, I've been able to sit in lots of people's offices, hospitals, private practice settings, universities, and everyone is different. so it's going to get tricky to give any real specifics, I think, on that.
And that's so true, Judy. And one of the things that we're learning as we're developing these guidance materials and things, people have been really innovative, such as having their clients, if they have close access parking, wait in their car to receive a text to come in for their appointment. And that way, no two clients are crossing paths, either leaving or entering the waiting room. So people are using those strategies of spacing out patients more so that they can both clean in between patients. But again, patients aren't congregating in the waiting room when there's a small waiting room and those kinds of things, and crossing that 2-meter barrier. So there are a number of tips that people can pick up from those materials, but I'm sure in their consultations with colleagues and in discussions in their psychological community, they will be able to develop a number of quick strategies saying, you know, for myself, I never thought of that texting in the car. It makes perfect sense. We do it at restaurants. If our table's not ready, you know, they say, well, give us your number. We'll text you when it's in. You can go for a walk and come back. And I think those are the kinds of practices that will become every day in order to keep everyone safe and healthy.
Oh, and I'm just going to build on that for a sec. I am most excited about that peer consultation. This is how we operate. So we don't just get guidelines from the college. We work, we learn best practices from one another and our wisdom, and we really check in with one another about what we're doing. And before we started the live one, we were just doing that, Richard, Troy, and myself. What are you doing in your office? What are you doing in your office? How can we best take care of our staff and our team to take care of all of you in the province? And so I'm quite excited. We're going to launch next week our panels, we're calling them. So they're kind of like live peer consultation. The first one on counseling psychology, the next one on supervision in psychology, and the next one in school psychology practice. It's not the right answers. It's not a webinar teaching you to do things. It's our peers sharing, here's what I've done, here's what's worked, here's what hasn't, here's some innovative ideas, and then time for everyone participating to say, well, have you thought of this, or could we do that? And that's where I think we're going to see some real innovation to meet and exceed the guidelines and do the best possible patient care.
And I think, Judy, you know, you're so right in just talking and communicating to people. And so one of those examples in those consultations is when we look at the whole issue of contact tracing, which has been brought up in some of the questions that were previously submitted about how do I address that in my private practice. And that will raise some questions. So if you yourself have been in contact with someone, and then you have seen a full slate of clients that week, how do I deal with that issue? And of course, you are obligated to give those names of those people who you have been in contact with. But of course, you only give the minimum amount of information. I'm a professional health service provider. I was in contact with this person. You don't need to explain why they were seeing you, what they were seeing you for, all those kinds of things. You simply need to provide the name. And some individuals who are concerned about, well, am I violating that individual's privacy? Well, no, it's because that is part of the public health order. But also if you want to be extra careful, you can revise your consent forms to state that during the COVID pandemic, if I or any of my staff have developed symptoms or have come into contact with someone, your name and contact information may have to be provided to Alberta Health in order to fulfill requirements of the public health order. So those are kinds of things we have a question to the Alberta Health contact tracing app to find out what the parameters of that are. So if people have more questions about that, hopefully we'll be able to provide some more information in the future for that. But again, to know that those individuals doing the contact tracing are obliged to follow privacy legislation themselves, and you are obliged to follow the public health order, which includes providing information to Alberta Health if you have developed symptoms or come into contact with someone who has had COVID-19 symptoms.
Yes, excellent comments, and that it's timely because there were a few questions arising about the implications of the contact tracing or the use of the app, concerns around confidentiality, and I think you've addressed that quite well. So that moves us on to procedures around informed consent, some things that you might wish to consider. Specific issues that were raised are things like, what if my client tells me that they have had or have tested positive for COVID-19? What am I required to do? That sort of relates to contact tracing, but does it relate to any other sort of requirement to report that beyond that avenue? So I'll leave that first question with both of you.
From the college's perspective, you are not required to report someone simply because they have COVID-19. You are, however, if they have not reported themselves and if they are not following the practices recommended by the Chief Medical Officer of Health, your first obligation is to discuss that with them and see if you can gain their compliance. And then if you can't, there is a requirement that you, under both the Public Health Act and the Health Professions Act, that you would report them if they are a public health risk.
And you'd report them to?
Alberta Health.
And just to add to that part that's specific to consent, Richard mentioned earlier that the American Psychological Association has been producing incredible resources at a pretty quick pace. They have an excellent legal judicial team there and practice advisors, et cetera, et cetera. That's a big organization, and they really are quite focused on what they're doing right now. And so they've provided a sample consent for seeing people in person during pandemic. So we have that again up on our website. I think I've sent a link out in my Friday news to people. And when they create these resources, they say, now tailor them to your region, your organization, your logo at the top, but you can take that together with CAP's guidelines and say, how can I modify this? What do I need? It's not necessarily that you have to be inventing this from scratch, but there really are these big considerations. So how are you addressing them? And then it's like all consent. It's not just a piece of paper someone signs. Do they understand? Do you have a good handle on it?
And I agree with Judy, and I've had a look at that consent form, and there are some helpful tips in that consent form that you could integrate into your form or your informed consent discussion. And Judy is quite correct that consent is more than a form; it's a discussion, a question and answer. And but I think that there are some really good up-to-date resources that include COVID-19 kinds of pandemic issues that a person could integrate into their form. And again, I would see that as a relationship building tool for clients, because they know that you're on top of the most up-to-date science and you are taking their interests to heart.
Thank you for that. And I would just add that, anytime there's a change in condition, of the work we're doing professionally with someone, whether it's a transition towards something like telepsychology delivery or back to face-to-face, our obligation has always been to revisit those informed consents, have a discussion, make sure our clients feel informed, and consider the kind of factors that we need to. And there's going to be some guidance in what's coming, I know, in terms of the kind of things you might wish to consider, the client's anxiety around that. They might express all kinds of concerns, your anxiety, the use of all the PPE, the distancing measures. There's lots of things that you might want to consider in informed consent. So let's move on then to there are some specific questions that just sort of deal with safety related concerns in a more general sense. And one of the questions pertain to specifically to work with children. And they're asking what will be the guidelines and expectations in order to keep everyone safe. They mentioned play therapy, use of play therapy objects. I think the similar could apply to standardized testing and testing objects. And so what are some of the comments or recommendations or guidance in terms of keeping children safe in particular, and use of manipulables in a therapy context or in a testing context?
Well, from the college's perspective, it's again going to be important to screen each child through their parent prior to coming to their session. And if they're using manipulatives such as toys and things like that, to clean those toys between client sessions, similar to testing equipment that involves manipulatives that you would share with that client, is they must be cleaned and sterilized between sessions. And so that may require for the play therapist to possibly limit the number of materials that they make available for that play session, or to keep close track of which materials the child comes into contact, and either set those aside before the next child comes in, or sterilize them before the next child. So certainly it's going to require some careful consideration of those objects and what kind of objects you have in your office so that you can minimize potential exposure to COVID-19.
Do you have anything to add about that, Judy? Are you getting any questions from the therapists where you are?
No, actually, so not about manipulatables. Sorry, I don't get used to that. But just really about adapting environment. And I really actually think about environmentalism, where now I know of play therapists that are saying, well, we're doing more art therapy and I'm just providing some pieces of paper and crayons or a marker, so you have less things to be sort of sanitized and things can be thrown out. And I mean, ideally, we don't want to be throwing things out. We want to be kinder to the environment, but we're weighing all of these risks right now. I haven't worked with children in years. When I did, I own some excellent games like about grief and mourning or separation and divorce. Those are very, very powerful, but would be really tricky to sanitize, those cardboard sort of surfaces and then the little players and the pieces. The brilliant thing is that most psychologists I've ever met are very curious and tend to be creative. We have got incredible tools at our disposal. It just means shaping up how we use them and when we use them. And I bet you that's an excellent peer consultation support group, are people who work exclusively with children or in play therapy, because I'll bet you they are sort of modifying things at a pretty quick pace right now.
And just to add to Judy's comments is that, of course, there is science out on the shelf life of the COVID-19 virus. So for example, I believe it's 24 hours on soft surfaces, 3 days on hard surfaces. So psychologists who have objects that their clients are touching or working with should be aware of that. And then it may simply be setting aside and rotating objects if they can't sterilize them, between just setting them aside and knowing how long they've been away from someone, so that the virus is likely not active.
Great tips. So another question that's arisen around general safety is what if we're aware of our colleagues and that are maybe not exercising publicly ordered safety measures, or we feel that they may be engaging in practices not in keeping with the guidance from the college or elsewhere? What should their process be if they face that? I'll ask that to Richard first.
Typically the approach we always take is to approach it from a collegial perspective. Inform the person that they might not be aware of the orders, try and provide them with some additional education, some coaching, some support to say, I'm not sure if you're aware of this, that there are, in addition to potential professional obligations to the college, you have public health obligations, and those public health obligations also come with consequences and fines for non-compliance. And determine if that person is responsive to that guidance and coaching. And you may say, I've attended this conference, or you can watch that webinar, you can go to PAA website and get some information on that, or to the college website. We both have COVID-19 dedicated resources. And if upon that coaching, that person is still not taking appropriate steps for public safety, they can certainly either contact public health or the college.
I'm going to add to that just because I know we've got 5 minutes left. And
okay.
So Troy, you are the keeper of the questions. Do you have some top ones for us to squeeze in?
Yeah, I think that this one is for you first, Judy, actually. Let's move on to many have asked about implications around liability and insurance coverage during this time, especially as they consider return to work, any potential risks that they may face, and what the advice is around that. So I'll put that to you first, and then see if Richard wants to add anything.
Yeah, I'll let Richard do the specifics. Generally, though, those of you who are covered with BMS, they have produced a separate, I think it's a 2-page document actually about return to practice during a pandemic. And so realistically, if your insurance broker has specific guidelines, you want to be very familiar with those. They're quite good. Contact them directly if you have questions or concerns about those guidelines, because it is one of the top recommendations in North America. If you're going back into in-person practice, are you very clear on your coverage and what the recommendations of your provider are? That's really the top recommendation there.
Yes, and I would just like to echo what Judy stated. I know I spoke to BMS this week. I had a question about their practice disruption insurance. I was wondering for our members, does it apply for our members who had their practices disrupted? And unfortunately, it does not. But when I contacted them, they wrote me a nice letter and said, that's a great question. Here's the answer. But they said is make sure that if anybody has questions that you direct them to BMS, because they want their licensed professionals to provide the best and most accurate advice. And of course, we practice that too. As psychologists, we say, see a licensed or regulated psychologist if you want the best care. So they are very, very receptive to receiving people's questions, or by email or by phoning their 1-800 number. So I would encourage anybody who has questions regarding their liability practice, and I know it's insurance month for most people, that they should contact BMS to make sure that they're adequately covered.
Yeah, I think the last time we did this town hall, they were still making decisions. Psychologists were one of the last groups that even had business interruption insurance, and there was a precedent about to be set. My understanding is that precedent has just been set now, and it has to do with the pandemic and not coverage in relation to the pandemic. And so that's not going to be good news. And not very many of our members, there was actually, it turns out, only 500 in all of Canada that had that additional coverage. But for those individuals, it's really important and impactful decision.
Excellent. Well, as we come to our final few minutes, I just want to invite sort of concluding comments from both of you. I do know that there were a few things that were brought up in the chat room, specific issues, and I would strongly encourage any of those that didn't get their questions answered to contact either PAA or the college, as we'd be very happy to address any specific questions that we didn't get answered. By the way, Judy, there were some people saying, how do I get those billing codes, for example, and you can, I'm sure they can contact Judy. So just to do a wrap up, I don't know who would like to go first to kind of give some concluding comments and words of wisdom on guidance for the members as we consider this next time forward.
Judy?
Sure, actually, so I quickly wrote down that number. I'm sorry I didn't give that out right away. Practice IDs, and they're all often called PRAC ID, are given by Alberta Health. The phone number is 780-422-1522. Poor Troy, let's see how good his memory was if he could put that into the chat box. But really, realistically, Google it, you can find it. It's an application, so you need your practice permit when you apply. More importantly, contact them or go online and you'll get the good information about what those practice IDs are and how they work. I've had mine for years. They really are just an extra service to our colleagues in psychiatry. I just wanted to say that, you know, on top of sort of robust member supports, we really are doing about 3 main areas right now, the PAA. We're really trying to summarize what's going on in the research and practice, because if you're just out there reading, you will drown in this right now. We're lucky to have a team so that we're able to do a bit more of a robust overview, basically about psychological coping during a pandemic. Media fact sheets, infographic. We even have a PowerPoint presentation that you can use with clients or groups or organizations. We're happy to give those to members to use. Otherwise, sort of summarizing that information that you need, important updates, resources, training, notices from third parties. We're just trying to collect that for you so you don't have to hunt it down individually. Staff are very helpful if you have trouble finding things. And of course, taking care of the public, the Disaster Response Network, which as of this week will be accessible to Albertans who are deaf and hard of hearing. It's a great announcement I'm very happy with. Our referral service is seeing increasing need. So now that we are out of that crisis mode, as predicted, Albertans are requiring more need. And of course, good public education resources and infographics. My favorite quote is always, let's do too much calmly and together, and we'll learn a lot and get through this together. Richard.
Well, I'd like to thank everybody for taking the time to spend with us and learning more about the navigating psychological practice during COVID-19 and post-pandemic. I look forward to sharing new guidelines for returning to practice and want to encourage everyone to read them and contact the college if they have any questions. And we will continue to make our best effort to provide real-time communications to our members to ensure that they are fully informed and able to practice in a way that makes them feel comfortable that they're doing the right things at the right time.
Excellent. Thank you all for participating. Stay tuned for any future announcements of more town halls coming forward, and we appreciate all your time this afternoon.
Thank you.
Bye, everyone.